Specific to Washington State, we see that there are kind of like our death rate is 17.5 per 100,000. And that is particular to counties with like that are declared rural counties, which are kind of like 21 of the counties. So can you take that out of the slide? Sorry. Just see the numbers right there. It's okay. So 21 kind of like counties have higher suicide rates, and then the average in the whole state, and out of those 17 are identified as rural areas, so primarily agriculturally based areas. Next slide, please. Kind of like a couple of characteristics within that kind of like agricultural group, like what are like the most vulnerable people here. So we do see male people, average age of 61, female, somewhat younger. We do see what kind of like the reasons why kind of like people kind of like chose to die by suicide. That it was really kind of like physical health problems as one of the number ones, but financial stress was another very major driving point. And then what we do see what's more specific to this group is really kind of like that there are a lot of like self-blame factors if something doesn't go right with their farm or like their livestock. And that there's really a lot of like internalization, kind of like they focus on them doing something wrong. They feel pretty hopeless, and it's very existential when there's a crisis. The other piece that kind of like makes this a bit more unique is that there is quite a stigma around seeking help, specifically mental health help, which is kind of like also based on kind of like obviously farmers are extremely resilient as a group, and they have to deal with a lot of like things on themselves, by themselves. But really kind of like this idea here that seeking mental health support specifically is very is at least for like the somewhat older generation a really difficult piece to overcome. And then we have the last point here, that farmers are unique in that they have a lot of access to means for dying by suicide, because of the necessities of having to like, you know, kill animals on their fields, kind of like having the possibility to kind of like use firearms. They have access to that. They also have access to pesticides or kind of like other poisons as needed for their work. So kind of like they have easy access, and with that, if they get into a situation where they feel like I'm in a crisis, have tunnel vision, then they can kind of like, unfortunately, have faster access to these means. Next slide, please. Okay, so kind of like what are like specific sources of farm stress for farmers, kind of like compared to people like in the general population. They're really very vulnerable to kind of like weather patterns. So I just talked to a farmer yesterday who kind of like told me because of a 8-hour weather dip in December, they lost like crops worth $40,000. So stuff like that can just happen on a whim, and it's even though they took a lot of good precautions, it still happened. And so kind of like this kind of like pretty much drew the rug out under their feet, because it was half of like what they kind of like had invested for this coming year, and now they're below the poverty line for because they had to reinvest. So changes in climate, weather patterns obviously is a very predominant one, but also market fluctuation, government investment. Although there are certain areas that have good investments, other areas are kind of like not in the focus. And then just limited resources, because this is such an isolated living, kind of like childcare resources, for example, can be far and away, healthcare, grocery shopping even, or veterinary services. I had one farmer kind of like who just told me that one of her, they were lambing, and her sheep kind of like couldn't make it. And so there was no veterinary that they could get in time. And luckily, this farmer was very adaptive at helping the sheep herself. But if you don't have those skills, obviously that's another big drawback. And then on an individual level, we know that there's quite a like higher rates of like physical health issues for farmers, because of like, obviously this is a lot of hard labor intensive work, but also kind of like, for example, just sitting on a tractor for hours on end kind of like is not kind of like healthy for the body, because it's like a consistent kind of like movement that kind of like the body has to endure. If there are kind of like difficulties within the family, they're very often kind of like on their own. So kind of like if there's divorce, or if they're kind of like a partner conflict in their partnership, it kind of like can really kind of like make things very lonely, and kind of like also kind of like then have additional workload that they kind of like cannot master by themselves. Alcohol or kind of like substance use may be one of the efforts to kind of like try to deal with this. That is often kind of like not, kind of like has a detrimental effect in itself. Then we do know that kind of like financial costs often they can run on very low margins on farms. So kind of like if there's anything, it kind of like can push them over the edge. Maybe they are able to kind of like, kind of like deal with 1 year when they have like difficulties with their harvest or something. But if there's a second year, then they kind of like don't really have the resources anymore. It can be that there's a lot of like high financial investment necessary for the equipment. Just buying seeds might be a really high investment. So anything like that could be really could potentially create a very difficult, stressful situation for farmers. And then their social network. I mean, they live in rural communities. They usually have contact with other farmers, and maybe kind of like their religions or like their churches kind of like are also kind of like other networks. But it's not like in a city where you can like, you go into the next corner and, hey, there's this guy who can help me with my laptop, or I need a new answering service. So how do I do this? So they're very often on their own, kind of like finding solutions online, or kind of like how to deal with maybe other things in their life as well. Next slide, please. And then kind of like really, there is a lot of specific values in this community as well, kind of like that reliance on themselves that is necessary and needed, kind of like is really kind of like extremely strong, kind of like in some way maybe detrimental when it comes to seeking services and getting help from other people, because this is such an ingrained necessity, and also kind of like such a high value for them to kind of like be able to deal with adversity themselves. And then kind of like farming is not just a job. I mean, you don't leave like your job at the door when you get into the house. This is really a 24/7 endeavor. And kind of like they have to get up early or late, or they have to do something with their livestock in the middle of the night if necessary. During the seasons, kind of like it's just very, very labor intense. So kind of like other things kind of like fall by the wayside. There is no like, I can go out on Wednesday night and go bowling every week or something. It's just kind of like it's their whole life is very centered around the work on the farm. And then if there's any kind of like difficulties on the farm, like this is kind of like the livelihood for potentially the next generation and the generation to come thereafter. So there's a whole like, there's a lot of pride and a lot of like value within the land and kind of like the work. And so kind of like giving that up or kind of like having difficulties with that is really kind of like very, very existential. So there's a lot of identification with the profession. Farmers are, I want to say, maybe like other people who just identify very strongly. The best people that I can, and it's not a good comparison, but maybe veterans that kind of like have to kind of like transition back into civilian service also kind of like have that identification with the military and have a really hard time. So kind of like, I think if we kind of like think of other groups who are kind of like very, very identified with what they're doing, this is kind of like even stronger for farmers. So like lack of alternative pathways, just in the sense that usually their whole life decisions when goals and values have been centered around being a farmer. So kind of like when they're struggling with the farm, this is really, really difficult for them to find alternatives and how to kind of like lead a valuable life. Next slide, please. So farming in itself is a stressful profession. Just listening to the farmers that I'm working with, I have the highest regard for like what they're doing, how hard they're working, and how much this also kind of like has a priority in their life and kind of like takes a toll on their physical health and also on relationships at times. As a group, this is really a very resilient group. So this is not a group that has like a high rate of mental health illness already. If they would have that, they probably wouldn't be able to be successful farmers. And so kind of like really kind of like, it's kind of like this multitude of things coming together when they kind of like feel like hopeless and they don't know where to go anymore. So kind of like this idea of, I tried so hard, I've worked so hard for all of this. And now here's kind of like, I don't know, that streak of cold weather that kind of like ruins everything. And all the work that I've put into this for years is kind of like destroyed. Next slide, please. We don't really need to kind of like go into this too much detail. This is just kind of like maybe specific. If you're looking for signs of like stress on farms, we could say, you know, kind of like care of livestock might be declining. We might have an increase in accidents. We might see that the farm set is kind of like just changing in appearance. The children might be showing signs of stress. There might be tension within the relationships. There might be a higher use of alcohol or other substances. But obviously, all the other things that we see in the general population are also kind of like happening. Sleep difficulties, just kind of like feeling unmotivated or having less energy to work and things like that. Next slide, please. So this is just a short thing that obviously the voucher program that we're doing in our clinic, or that we're kind of like through which we're providing services, is kind of like what Don McMorran has been able to secure. He received this Jody Shelton Memorial Award from the Portier Family Trust, and he can tell you much better what this is all about. But this is basically the current financial resource for us to kind of like provide the services that we do. Next slide, please. And so the clinic, as I said, is a training clinic for our PhD students at Washington State University in clinical psychology. So we have this unique opportunity to have a good pool of people who can be pretty quickly available. So right now we have set up a voucher program through this funding from Donald McMorran. There we can offer 6 therapy sessions for free. We offer them by telehealth. We can like accommodate as much as we can to farmers, like within their lunch breaks, early mornings, late evenings, whatever, kind of like, or maybe in between after they did their chores. We kind of like try to make it as easy accessibly for them. Sometimes we have sessions where they are in the car or on their tractor, and kind of like just turn the motor off, kind of like to be able to talk to us. Obviously, this is a telehealth service, so we prefer it to be both video if possible. That's sometimes a struggle because that's not always the case that it's available for all the farmers. But it is anonymous, and so kind of like that's often a very important piece for the farmers. What we kind of really try to do, we want to kind of like decrease any kind of like obstacles to receiving mental health services by being very flexible. So once they call, they get an immediate call back from us. They usually see somebody within 2 or 3 days the latest. So it's not like a 6-week wait period or 3 months or whatever you might have to wait for in others mental health providers. And we really try to kind of like meet the farmers where they are, as I said, like either in setting or kind of like what the difficulties that they bring into the sessions. Next slide, please. I did want to kind of just highlight, so kind of like how can we sustain this service? Obviously, we will need to find other funding sources if we wanted to sustain this, but the uniqueness, I just want to kind of like highlight too, that the students that kind of like are currently providing the services, you know, there's a training component where we kind of like work specifically with them to kind of like work with farmers and kind of like be aware of like what are like their specific needs, their specific issues, and kind of like what are maybe also topics to approach or maybe better not to approach. So for example, asking a farmer, why don't you just give up farming, is not a good idea, because that is for the reasons that I told you. So really kind of like knowing what you like, what is specific to this population is important to be effective in these kind of services. So with this training program, we have the opportunity to actually kind of like basically train the next providers or the providers of the future, and our graduates kind of like are across the whole country once they graduate, so that they don't stay, some of them stay within Washington, but they also go into other states. And I think I'm at the end of my presentations. Thank you all.
Thank you so much, Connie. That was really in-depth and informative. I appreciate it. I'm going to turn it over to Don McMorran, who's participating on Zoom today. He's going to share a little bit with us about the AgriSafe line, and then Representative Dent will start the questions. Don?
Perfect. Thanks, Jamie. So yes, when we started in on our farm stress suicide prevention work, we were mandated by USDA to work to develop a call center um, for the Western region, which is 13 states and 4 territories in the West. And so our original partner on the call center was Farm Aid. And we really liked Farm Aid because they have operators that came from agriculture. So, as a farmer was reaching out to them, they would speak with somebody who really spoke their language, and we really like that about Farm Aid. Um, some of the well, and also within that structure, Farm Aid was working 8 hours a day, 5 days a week on the East Coast, and we felt like they weren't really doing a great job of serving the West Coast. And so when we got funded in the third round of USDA Farsan funding, we reached out to Farm Aid and suggested that they add an additional 8 hours per day, 5 days a week, and host operators on the West Coast. And they agreed to that. And we actually we have now 2 operators located in Washington State working for Farm Aid on their resource line. It's a great line. They do a really good job of connecting farmers up with resources like attorneys or CPAs or USDA programs that are available to them. What they don't do is work with crisis. And so once we learned about that and them not having a desire to work in crisis, we wanted to, as well as them not working a 24/7 line, we wanted to make sure that we were covered for crisis for farmers in Washington states, as well as other states within the United States. So we reached out to another organization called AgriSafe, and they have a call center called the Agri-Stress Hotline. That number, if anybody's interested in it, is 833-897-2474. I'll say that again. Their number is area code 833-897-2474. And they actually run a crisis call center, and that is staffed 24/7. And they're located now in Washington, Oregon, Montana, Wyoming, and Colorado. And so we're able to get those 5 states online currently. There's also some folks on the federal side of things that are trying to get that call center in all of the states within the United States. And so there's Senator Gillibrand, she's out of New York. She's one of the proponents of that. There's also another senator out of, I believe it's South Dakota, that's pushing to get a 24/7 call line set up for farmers and farm workers in the United States. I think the big impetus behind that is that most of my farmers and farm workers, they want to talk to somebody who really understands them, understands the plight of the American farmer, and so they want to pick up the phone and be able to call someone that understands what they're up against. I think the downside to the AgriSafe call center is that you may or may not be talking to an operator that has an agricultural background. They do try to educate their operators, but it's not something that's mandated by their organization like it is in Farm Aid. So, in my conversations with Representative Dent, we talked about how neither Farm Aid nor agri-stress call centers are the perfect mechanism for our farmers, and perhaps there's room then to create something that would work really well for Washington State. So with that, I'll go ahead and close things out and be happy to take any questions or comments the audience might have.
No, thank you. Thank you, Don and Connie. Both excellent presentations, and I really appreciate both of you and your unique vision of agriculture and the challenges we have. And if there's a takeaway from Connie's presentation, is she really framed the challenges and all the issues that face our agriculture producers today. And the one thing that I'm older than most of you in the room, but when President Kennedy was in office, the one thing that he said was, farmers They buy at retail, they sell at wholesale, and they pay the freight both ways. And it's a challenge. And when the farmers have a challenge and the ranchers are challenged with low commodity prices, it actually affects the entire community. So then you're looking at your fuel suppliers are selling less, your equipment dealers that are slow, and people are laid off, and there's less farm workers to be hired. They get by with less. And so all of these things are factors. And one of the passions that I have is, we need to help these folks handle those challenges, and they are challenges. And nobody's accused me of being a farmer. I run cattle in Buffalo and work at it pretty hard. It was not how I made a living. It was my night job. It is a challenge. And even today, it's still a challenge in what's going on. And my son's at home sending me texts because he has some issues that we need to deal with today. So, it's an ongoing program. Anyway, but we have some questions here that were panelists that we're so delighted. I'm just so delighted that they agreed to be here. So we have 3 questions, and we'll start with what are the unique needs of people in rural areas and in the agriculture industry who are experiencing a behavioral health crisis? So who would like to start? Or I can choose if nobody wants to raise their hand. So, okay, Levi, you can go first.
Thanks, Representative Dent, and thanks to Don, and thanks to Dr. Kirchhoff as well. Just really great information, and it really puts us in a great position to start this conversation about unique needs. We've seen a little bit about what some of those unique needs are. I can share a little bit about how I think we can influence that. In my position is, currently as a crisis contact center provider for both regional crisis line and 988 work, what that might look like. But then, some of the kind of on the ground and realistic pieces of this. I think, we've heard about unique needs. There's additional stressors, there's weather, there's markets, added stigma, added, just additional things that can create, higher rates of suicide, as we've discussed, but, additional risk factors. I think for us at 988, what we can do right now is make sure that we expand on agricultural-based training that we're doing, but I think we can find some common things that we can focus on currently to make a difference as we work on looking at these other things. And I'll just kind of mention some of those. I think our counselors are really good at dealing with acute suicide crisis or acute suicide ideation. So, regardless of background, those counselors can help in that immediate need. And then we can work on building in additional pieces and looking at different options and for more sustainable pieces. I think for myself, spending a lot of time in a tractor, it's very isolated. There's a lot of solitude. Now knowing that there's an easy number that you could call to talk with someone, or even text. I get a lot of text messages from friends that are maybe out on a tractor. It's a little bit easier now than when I used to do it, because sometimes it'll be driving, helping drive on its own. But I think just creating more recognition there. But I think about other barriers too, beyond what our counselors might do to support what mobile crisis team response looks like in a rural area, or for farmers and ranchers. And I think we've discussed some of those. I know Representative Schmick has mentioned, in many areas, the likely first response is not going to be a mobile team. It will be maybe a volunteer firefighter, maybe law enforcement, maybe both. So what are some of the things that can be focused on to try to build up training there and increase resources for mobile response and intervention there? And I think as a piece of that, some of the other unique needs that we have to fight in those areas are, when it is rural, people are going to know that things are going on. There's not a lot of anonymity. So that can be a barrier, if someone sees, so-and-so's vehicle here, or they know, oh yeah, this group went out to that person's house, what's going on there. So being aware of those things and trying to create a better environment where intervention can happen and some of those barriers are broken down.
Thank you. Levi.
So I want to touch on this piece that you were just talking about around stigma. As part of my position, I run a local suicide prevention coalition, And one of the pieces that we've been running into is folks don't want to come up to our booth at community events because they don't want to be associated with, oh, you're going to the suicide prevention tent. And, you know, Walla Walla is a small town. It's not as small as some other rural communities, but that's still a piece of it. Folks don't want to be seen as being weak, needing behavioral health services. So I think that's an important piece to touch on for sure. Another thing that I see within my community specifically is kind of this breakdown of the crisis continuum, specifically someone to respond and somewhere to go. So within our community, it can take hours for our mobile crisis teams to respond. And by the time mobile crisis might respond, that person is no longer in acute crisis and therefore does not qualify to get like a respite bed in our crisis center that we have. So that's a piece that I see really unique, is that this time and space in between when somebody might call for services and when services might get there really alters the outcomes for those people.
Very good. Thank you, Cassidy. Rob? And incidentally, in a small town, everybody knows what everybody's doing. So there's no anonymity there.
Try being a therapist in a small town. It's fun. You know, so I think you hit on it really well. The distance when you're living in a rural community as you go through things. A couple weeks ago, I had a client that was in crisis in Grand Coulee, which is about 100. Yeah, it's about 100 miles north of where I am. And it's about an hour and a half to get up there. So it's about 85 miles, whatever, math. It's not my strong suit. That's why I'm a therapist. So I literally got the call about 10 o'clock in the afternoon that my client was going to the ER. I continued through my day and continued seeing clients. And at the end of my day, I found out my client was still in the ER. So I drove north to Grand Coulee to see them. And about an hour after I got there, the mobile contact crisis team actually arrived. Obviously, the client's already out of suicidal ideation. He's no longer acute. There's no way we're going to actually put him into a respite bed at this time. But you know, that distance in itself and the lack of resources as we go through it's not there. We have a hospital that if you're been run over by a tractor, they know exactly what to do as you go through that. But if you're struggling with suicidal ideation, they want somebody to come from outside of the hospital to come in and sit down with somebody there. You know, we put a lot of money into these critical access care hospitals in order to be able to have the support staff there for somebody that's actually dying, but we don't actually focus on mental health with them as we go forward. You know, one of the big challenges I think we could do is actually have them using some of that money to actually bring in mental health providers as we go forward, because when you look at the ACE score of everyone that's out there living in rural, low income places, it's usually pretty high, and they're at a high risk for actually committing suicide. So we have to do something as we go through it, or we can just let them continue to suffer. And that doesn't sound very humane to me.
Thank you, Rob. I'd like to go next to Representative Schmick.
Well, first of all, I want to thank everybody who provides services currently, because it's vital. The one thing I would like to add to the conversation is that when I'm actively talking to farm groups about the ag suicide situation and the financial and the other stresses that cause this, I guess my concern, or what I'm hearing for feedback, rather, they'd like to talk to somebody as close to home as possible. And I think that I was encouraged to hear the agri-stress, your staff in the 5 Western states, and that's a great start. I think somebody who's trained in ag, for lack of a better term, speaks ag. You know, I can honestly say farming, there was times I hated going to the bank and looking for financing. I mean, that was an extremely stressful period. I'm just using that as an example. But I think that people that have come through that, it'd be great if we could get a few more farmers and people very associated with the farm industry that understand some of the trigger points, stresses, I think is great. And I'm glad to hear Mr. Van Dyke offering those services, because I do believe you can talk people off the ledge. I guess my question to the rest of the panel, because this is something I don't know. We've talked somebody has extreme stress, they're considering suicide, and they've gone past that. Then what? I mean, do we let them go home? Do we follow up? I guess to me that is important, because even though they may have gone through the extreme crisis, most likely, how do you deal with the stresses that cause this? And I guess I'm just thinking, what's the follow-up to that? And this is more for the counselors to answer, or what are we going to do for those folks? And I appreciate the chance to visit and really share some things that have been on my heart. And so thank you.
Thank you, Representative Schmick. Appreciate that. Truly do. We'll go to Don McMorrin.
Thanks, Representative Dent. Yeah, I wanted to spend some time on the agrarian imperative, and it's something that was created by Michael Grossman, and I'll send it to Jamie. She can post it on the chat. But if you think about the generational pressures within agriculture, this is something that really stands out for me because I'm a fourth generation farm kid. You hear these stories about how hard your ancestors have worked, and how they came across from Scotland to Ireland, Ireland to New York, New York to Michigan, Michigan, Kansas, Kansas, Oklahoma, Oklahoma to California, California to Washington State, where they found this really idyllic place to settle down and to farm, and they found these great soils, and how they had to mortgage their farm 7 or 8 times to make things work. And by God, when you inherit it, you better keep this thing going, right? And those are the stories you hear as a child coming up. But our landscape has changed, right? Farming, when my great grandfather farmed, he grew 6 boys on a 40-acre farm with 20 cattle and milked them. So you can't do that today. Our landscape has completely changed, and those are the things that stand out in my mind, because I see commodity prices, with the exception of beef right now, everything is trending lower. All the input costs are higher, and our farmers are under some tremendous stress to make ends meet at a time when interest rates are high, and there's just a lot of stress. And hearing those stories in the background, you don't want to let your ancestors down. And when you do, you often think the worst. And so I think it's just a matter of us doing as much education as we can. And, we've got folks all throughout the state going to pretty much every conference and every fair that we can get our hands on to try to get that education out there. And it's still not enough. So having a resource line that speaks specifically to farmers is very important. And I think it's something that we should definitely try to hang our hat on.
Thank you, Don. Appreciate those words. And we'll go to Connie.
It's on. Okay. Yeah. So, I mean, my slideshow already had a couple of things that I think are very specific and unique, and also kind of like thinking like what is, kind of like what's a more sustainable, more comprehensive system. I really think having like frontline suicide prevention hotlines is great. I'm not quite sure how like a general 988 hotline would be utilized by farmers, just because I think they really need specific language issues knowledge. I do think that that kind of like beyond that is just an entry point, if at all. Kind of like I think there would be a lot of like looking out for other farmers, kind of like that we need people on the ground who kind of like are aware like what's going on, and maybe they hear, oh, somebody died. Can I reach out to the farmer and know kind of like how are they doing? Kind of like how does this affect them? So I'm more preventative basically. And then I really think if somebody is in crisis and reaches out, which is what we want, then kind of really having a lot of like resources available for them. So that resource piece I think is really important, where they can see like who can I talk to about like I need a vet. Maybe I need like short-term labor just to help out with the farm because my partner had an accident and cannot work. So I need them now. I don't need them in 3 months. Some quick services that are kind of like accessible immediately. And so kind of like, I think our voucher program, for example, can help with like somebody mentioned, like somebody is suicidal and they need like services, mental health services. Yes, we can be there for 6 sessions for free. And then beyond that as well for like very low affordable fees if necessary. But, you know, things like that are quickly available and really kind of like basically where people kind of go to the farmer or are in contact with the farmer, see what is the specific problem, what do they need and resources, and how can we connect them. That's, I think, what's really a key piece as well. So.
Thank you. I appreciate that. And I'd like to follow up with what Representative Schmick was talking about, the finances and the challenge with money and not wanting to go to the bank when it's hard to make a pencil. And so I don't have a very large place, but right now, where the price of fertilizer is so up, I have not put on fertilizer, which means I'll have less yield, but I can't make it work out to put on more fertilizer to grow more hay because then it will cost me more money and the market is depressed. So you get in it's a catch-22 and we all can get into that. So these are challenging times and challenging issues that our farmers and ranchers face. The second question is, given these differences, what are the implications for the behavioral health crisis response system? In other words, how do we need to approach crisis response system improvement to support people living in rural and agricultural communities? And I'd like to ask our panelists to be kind of more direct and we'll move along here because we still have another question and I want to have time for questions too from the folks in the room. So Cassidy, would you like to start this time?
Yeah, this is a great question. It's actually been something I've been thinking a lot about in my work. I recently was on a presentation to our Community Health Advisory Board, listening to our behavioral health ASO talk about like contract services with our crisis servicer, comprehensive healthcare for our area. And just the conversation around like contract deliverables was very interesting to me. And I think one piece that could be brought into that is understanding how were these contracts developed and were they developed with agricultural and rural communities in mind, or are these just blanket contracts that are out there for crisis services within our state? Because I think that the specific needs for rural and agricultural communities are much, much different when it comes to these crisis services. So what I was hearing from this presentation is saying, oh no, all of our contract deliverables are being met. And yet there are still people in our community who don't feel like their interactions with our crisis system have been helpful and people are falling through the cracks. So that's one piece that I've really been thinking about and how we could potentially improve these systems within rural and agricultural areas.
Thank you, Cassidy. Levi?
Yeah, I think, you know, I think about this pretty much all the time and things that we can do. And it's going to take some creativity. It's going to take looking at things differently. You know, a lot of collaboration. We've talked about a lot of different things here today, and I don't have the best answers. I know we can build up the existing pieces to be better and try to incorporate some of these things in, and then look at you know, possibly layering in specific expertise and other portions throughout that will help kind of close some of these gaps. I think, you know, that's where we can start moving things, and that might lead us to a place where we've seen improvement here, we've seen improvement here, then we get, you know, kind of some synergy around things. You know, on our end, I want to go back just real quick to something that Rev Schmick said. You know, there is that follow-up piece. So building in kind of that continuation and, you know, for 988, for example, there could be that initial contact. All 3 centers also provide follow-up services and have specific follow-up counselors that can do outbound contacts follow up with an individual. And again, we can use the phone modality, but we can also look at chat and text if that's a little bit easier. You know, chatting and texting can sometimes be a little bit more subtle than being on the phone. And again, something to kind of look at those, you know, those stigmatized factors or barriers that might exist to reaching out. But I think it's also having more conversations from people that live in those communities, having more people from those communities in the rooms when, you know, decisions are being made, giving feedback. And then, you know, to the other end, when people are hearing about programs, they need to hear from people that they trust. So we need good partners in communities that trust the crisis programs, the crisis system, that are then talking to their peers that are farmers, ranchers, or living in rural communities, saying, hey, this is what this looks like. It may not be perfect, but these are the things that you can trust, you can rely on, and there are things within this that can be helpful.
Thank you, Levi. Let's go to Representative Schmick.
Well, I'm getting more answers than I had because I just asked more questions. And I'm glad to hear that. But again, I think I like the idea of layering in people, like Levi was saying, to fill in the gaps that we have with specific needs. I mean, I think Representative Dent and myself are we've got a pretty decent handle on what the stressors are. It's just now we need some people that are aware of those that can talk to folks and help them. And I suspect that might be a bit of a challenge to finding those right people, but not saying it's impossible. It's just, we got to find the right people. I guess that's all we want to say about it, Tom. It's just, I have a real heart for the growers out there that are struggling. And I don't want to see any more suicides, especially for people I know.
Thank you, Representative Schmick. I have the same sentiments as you do, and I have a heart for it as well. We'll go to Connie.
Thank you. Yes, no more suicides if possible. I agree. I think I like your idea in the sense of like, I think the hotlines that we have could get specific key people that they can recommend, or kind of like that can say, even, you know, I talked to you, hopefully I was able to help within the crisis situation, and I'm going to connect you with a farm specific response service. And I'm going to give your information. Is that okay? I think that would be a first step. And then kind of like that farm response team goes into contact with the farmer and either kind of like has a mobile response team that can drive out there, or kind of like at least has a first telephone or maybe video talk with them to see what exactly are the difficulties and further resources to connect them. And the other piece I think is really kind of like that people on the ground. I mean, I think who could be like first like responders in the sense of like community responses. I mean, you know, kind of like, do we have key people in like communities? Who could that be? I don't know, is there like a community structure that kind of like would make certain people particularly targets, like for example, I don't know, feed store owners, people who like sell farm equipment, people who have insurance companies, like can we kind of like alert them, make them aware of this problem? Can they provide them with like brochures that they hand out, or even kind of like telephone numbers of like response teams that could like maybe go out? So I think we have to be creative there. Who could maybe be first key points of entry to the person?
Thank you. Dawn?
Thanks, Representative Dent, and I agree with everyone's suggestion. I think it really all revolves around support. I was recently speaking with a farmer from Skagit County who had a suicidal attempt. Thank goodness he was not successful, and he knew he had a problem. And he sought to get himself help. And he's been in and out of mental institutions since. And he's told me, you know, it's out of pocket. He knows he has a problem, and he's paying $6,000 per visit. And he feels like he's on the right track, but it's also bankrupting him. So I think, you know, we need to think holistically about what we want for our farmers. And I think getting them good support is a great place to start. And unfortunately, I have to hop off the line. I have a 1 o'clock, but thanks so much for hosting today, and thanks so much for having me. Really appreciate it.
Well, thank you, Don. I truly appreciate your comments today and your passion for the subject and your willingness to work with us as we move forward. Thank you very much.
Appreciate it.
People who are just joining now that we're running over a little bit. Is that okay? Okay. All right. Sorry to interrupt. I just wanted to let folks who are just joining the meeting now know that we have this wonderful panel, lunchtime panel, who's talking about behavioral health crisis response in rural communities in the agricultural sector. And we have such good panelists. We're running a little over time, but hopefully you'll enjoy hearing from them. They're going to put in the chat the question they're answering now, which is, given the unique needs of rural and agricultural communities, what are the implications for our behavioral health crisis response system? We have one more panelist answering, and then Representative Dent, I actually have about 6 questions from CRIS members that are already, so I don't know if you want to take those before taking the round robin question, or just want to let you know that we have those too. Okay, I'll bring them up to you. Okay, sorry, Rob, thanks for your patience there.
Yeah, go ahead, Rob, it's your turn.
So, of course, and that's how it goes. What I would see is as the big difference is really culture as we go through that. And one of the things I think we could do to help our behavioral health system is actually recruiting out of some of these areas to get people into school and to become therapists themselves, so that they can actually speak the language of the people they're actually working with as we go forward. You know, if you talk to a elementary school kid, you ask them what they want to be when they grow up, they're going to tell you they want to be a firefighter, a cop, or they want to be an astronaut. There's nobody that's going to tell you that they want to be a therapist. And the path to being a therapist is really complicated and interesting and great. But if we could teach people how to do that and bring these people that come from a community back to their community, I think it could be really valuable.
Thank you, Rob. Representative Smith, do you need to leave early, or are you good for a little while?
I can hang on for a few minutes.
Okay. Well, we'll just jump into some questions that we have here, and I think these would be. I'm glad you can hang on for a little bit. I'm going to start with a question from Representative Orwell. Are there specific regional farming issues that would not be well addressed on a national line? And if you'd like to jump in first, Representative Smith, I would appreciate that.
I think that when you go in the Midwest, most everything's corn and soybeans, which we don't. We're the second most diverse state crop-wise, second only to California, and so some of the needs are different. I mean, a lot of times our needs are about markets, market access, getting our products to market, in the different. It's somewhat yes, but I think that there's some uniqueness here that it would be nice if we could. I would like to see addressed for the local growers, and I'll stop there. I'd like to hear what some of the others think.
Thank you, Representative Smith. Anybody like to take a stab at that question? I'm just gonna.
Off the top of my head, one thing I can think of that might impact agriculture in Washington more than like the Midwest per se is agricultural issues that are the result of wildfires. So crop loss from wildfires, fruit damage from wildfires, loss of kind of getting back to those generational pieces, buildings, items, and just, those pieces that make up a farm or a ranch that have been around for generations that can be lost to wildfire. So I think that's one thing kind of unique to areas of Washington state that doesn't exist in others.
Well, I could take a stab at that. My family, the Dent family, originated in the state of Iowa, and most of them engage in agriculture. And it's a different kind of an agriculture than we have here. It's while they do have this many inputs, and they still have to buy expensive equipment, and they farm large acreages, and they are at the will of the weather. But it's a little more laid back in the fact that they're dry land, so they count on the weather, they count on rain, but they have more opportunity because of that. There's times when they can't farm because there's too much moisture in the field, it's too muddy, they can't go to the fields. So they have more time with each other. And the coffee shop in Iowa is a big deal because every morning they're all there. And, you know, when I go visit, I go to the coffee shop, and but they work and talk with each other. And it gives them it's an out and an opportunity to have friendships that maybe you don't have in the state of Washington, or where we farm, and what Representative Smith was talking. We are very intense here, and in the Columbia Basin, it's an intense position. You don't have a lot of time. There's always something to do on the farm or the ranch, always, and so you don't have that time with the people. And I think that does make a difference. Although I think many of our issues all the way across the country are the same, but how we farm and how we approach things can be a little different. But we have a second question here. I'll take this one here from Kashi. Did I say that right? Kashi. Okay. Pardon me. Can the panel share any insights on the unique needs of children and youth in agricultural farming families? Anybody like to take a shot at that one? Can we read it again? Representative Schmick?
I don't think you can hide stress. If a parent is stressed, it's going to fall to the kids and other family members. They know when something's wrong, and they know they can feel it, they can sense it. And I think that that's an additional stress that, well, maybe farmers just want to hold it in, like the doctor had suggested earlier. They internalize a lot. But I do believe that stressors are felt by the rest of the family, and it affects them too. So if you've got both parents under stress, those kids are going to be under stress, and they're going to look for ways and outs. I think this would be similar to anybody else, though. You know, if they've got members of their family who are under stress, I think that translates and affects the mental health of the others too. I don't think it's a lot different, but people can sense it when you're under stress and something's wrong.
I think another piece with youth and adolescents is understanding where our school districts play a role in supporting behavioral health services, and the fact that many school districts do not have access to behavioral health services on site. So if they're lucky, they might have a social worker on site, but that is pretty rare. And then also factoring in like social emotional learning curriculum, and whether or not those schools are able to afford to buy new SEL curriculum and upkeep it and have somebody who understands SEL curriculum and can do that. So I think that's another important piece to keep in mind.
You know, I remember when I was in school, I had a professor that was very into family systems, and he would always say the sins of the father are the sins of the son. So if we want to support the children, we have to support the parents. We have to make sure the parents are okay enough in order to be good parents. Otherwise, we'll see that entire cycle of dysfunction repeat again with the children as they come through, and they'll just use the same negative coping skills that their parents have had for generations, and nothing will change.
Yeah, I think all great examples. Just two things that popped into my mind too is just you know, youth today have more stress than youth have probably ever had. And then if you have a physical ailment or something like that, it could result in youth feeling like they need to pick up, you know, kind of pick up the slack per se on the farm or ranch and do more. And another concern, you know, I always have is you have more access to lethal means by, you know, youth, possibly in rural or farmer agricultural communities. So always making sure to check in on those things as well.
I very much agree with that. I think that family legacy is really very important for farm children, particularly that idea that, kind of like this is our livelihood. And kind of like one other person touched on that as well. In other families, there's a father who works in one job and a mother works in another one. And if one loses the job, I mean, it's really difficult, but there is still a second income. But if the farm is affected, usually both parents are very much working on the farm, and it's kind of like affecting the whole family, maybe multiple generations. I mean, grandparents might be living there as well. And so there's a really huge burden of these youth to kind of like feel responsible potentially, to kind of like help the farm, get them maybe out of the stressor or whatever. So I do think that they're much more impacted than other youths potentially.
Okay, so I'd like to just jump back to what Representative Smith said, is you can't hide stress, and it's there, and the stress in an agriculture family, if it's on one person, soon it will be on everyone. And I'm going to give you an example. I'm not going to give you specifics because I don't think that would be appropriate for the family, but we had an agricultural family, a relatively large agricultural operation in north central Washington, and they were having some major financial challenges. And when the numbers are big, you get over $1 million, those are big numbers. Sometimes they're hard to comprehend. And their son committed suicide. He jumped off of a cliff, and it was pretty obvious that it was the stress the family was under. So you don't hide those things. And no matter how much you want to, when you're stressed, you're stressed. When you're overdrawn at the bank, you're overdrawn. And that's kind of the reality. So to the answer to your question, it affects everybody. So we have one more question. Claudia, we know a large portion, from Claudia, we know a large portion of farm workers are Latinas. What kind of mental health and culturally competent services are available to them and their families?
Not enough. Something that we're trying to do in Walla Walla is increase the amount of trainings that are offered by bicultural folks who can go out and do youth mental health first aid in Spanish, QPR in Spanish, and offering those sorts of resources to folks. But at the end of the day, we can offer those resources. But if you're not compensating folks to come to those things, folks are going to have lost wages. And if you're not offering it at the appropriate times, oftentimes Latino folks who are working in agriculture, they're up very early, they're working throughout the day. And by the time evening rolls around, they're just preparing for the next day. So understanding how do we make space for those types of resources while also making sure that they're not losing wages to get to those resources.
I have nothing to add, I guess. Levi, do you?
I think, Claudia, there, definitely another place where there can be more. I think we're constantly trying to make our services more culturally relevant, break down language barriers, do all those things. But again, that's just another area where we can continue to do more.
I also think that we talked about the stigma piece prior to, I think that is another particular area where I do feel like we need key players within the Latinx community probably to kind of like help with that, in the sense of like be available, talk about mental health, provide resources, and kind of like help there as well. I agree that there's much needed.
No, okay, thank you. Jamie, I'm going to ask this last question because it's really important. Okay, so from Kashi, also curious about what, if anything, have panelists seen be effective in reducing stigma around mental health conversations and or asking for help if suicidal? Go ahead, Rob.
You know, I think one of the easiest way to get somebody to talk about suicidality is just to be open about what's going on for yourself, or talk about your own struggles as you go through things. You know, so often we're as therapists, we present ourselves as perfect, that we have no emotional problems, but the truth is each and every one of us has our own version. We just experience it differently. So if you're open about that, you're actually vulnerable, and you present yourself as a person that it's safe to talk to, it's so much easier to get somebody else to tell you about what's going on for them when they don't think they're just being judged in that moment.
I think the stigma piece really is something that we should draw some attention to in the long run, because I really feel like the young generation is going to be our key entry point here. I really feel like because of social media, because mental health issues are luckily getting more normalized, and teenagers talk about it, and at least my experiences are much more open than my generation was. I really think those are like will be our key entry points, kind of like using, I don't know, 4-H clubs to kind of like make this generation like knowledgeable about mental health science, kind of like maybe teach them some very basic skills, or kind of like at least use them as multiplier for their families, their farm families, to kind of like start conversations about mental health. I think that could be a really great way. And then the other piece that Rob said, I think people talking about it from within the community, that's very powerful. If a farmer talks about their mental health issues to other farmers, nothing can trump that.
Anyone else comment?
One piece that at least my community is trying to do right now is kind of build this foundation of everybody speaking the same language around suicide prevention. And we're trying to do that through offering community classes. So like QPR, mental health first aid, assist, these really evidence-based trainings, and offering them to anybody who wants them for no cost, because that gives people an in to be able to ask these questions where they might not have felt comfortable in the past. And if we can just have an open and honest conversation about these topics, sometimes that's what folks need, is they just need to know how to approach it with somebody that they're concerned about.
Well, thank you. And, you know, I know in my life, I talk about mental health and the stigma every time I get an opportunity, because it is a subject I'm real passionate about, and I can usually work it into any group that I talk to. I can usually end around this topic of mental health and stigma, and I do. So, and you know, sometimes you get the microphone and you get to be in charge, and you don't give it back to Jamie right away. So, okay. So we'll get to the last question here. Closing. The CRIS is developing recommendations for performance metrics to measure crisis system improvement. As they continue developing these, what is one key takeaway about rural and agriculture communities you'd like the CRIS to consider? And we'll start with Rob.
You know, if there's a way you can work towards workforce development and encouraging more people into this field as we go forward, that is truly what we need, not just for rural communities, but for urban communities as well. You know, I talk to my friends that live on the west side. They're completely full. There's people calling every day. They're talking about 6-month waiting lists. They're talking about not being able to get into therapy. Nobody can get a scene. Creating a path and letting people know how to actually get to this point of having this job and being licensed and being part of a mental health care system, I think would be extremely valuable.
Thank you, Rob. Representative Schmidt, any comments?
Yeah, local. I just, if we're truly going to make an effort in the ag and ranch, farming and ranching area, we're going to need people who speak that language. And I think that's what I'd like to add to this.
Thank you. Cassidy, you have any comments?
Yeah, I guess my takeaway is that improving crisis systems in rural areas is not going to be easy. It's not going to be an easy win. It's going to take a lot of effort, and it's going to take continuous improvement, but don't give up on our rural areas because they're just as important as the urban areas.
Connie?
Yeah, I agree. And really kind of like farmers are our food source. I mean, if we let them down, it is going to affect all of us eventually. The question about metrics and measurements, I think really kind of like we would be successful if you would see a decline in like ultimately death by suicide. I think if we would see an increase in utilization of suicide helplines by farmers from the communities. I think asking farmers after they have received services what was helpful about it and what could we improve would be great ways to kind of like improve the system once we start implementing it. Those are the things that come to my mind.
And I don't know that that I can add a whole lot to what's been said, other than, and this is a little bit harder to quantify, but I think it's trust and engagement. You know, and maybe we don't have clear ways to measure that, but I think that's the case when we're looking at a lot of specific communities that are disproportionately impacted by high rates of suicide. You know, trust in access, and that is where things kind of start, and then we can kind of look at measures from there.
Thank you. And, you know, I'd like to say is the rural community is different. The folks are different. They think differently. Their lives are different. It's not an 8 to 5 job. It's 24/7, and you're there and you have responsibilities and challenges, whether it's to your farm workers or your livestock or, you know, the neighbors that you help and all the things that are happening. You have major responsibilities in your life and you carry a big load. And I think that you're not willing to share that with just anybody. And that's the big challenge that I see is you have this pain, this load that you're carrying around, and you're not going to go just share it with some random counselor on the telephone that you call. You need to talk to somebody that says, I understand, I get that. And maybe we can help you with new financial opportunities or directions or something. They need to hear something that relates to them from somebody who relates to them. And I think if I'm asking for the committee to consider anything, is think about the uniqueness of the folks that grow your food, because it is different. And I want to maybe explain just a second where some of this panelists come from, and some of the comments you've heard here today from some of us. But you know, I received a proviso. I put in a proviso in the budget for $250,000 this year in our state budget to support and finance a panel to look at the uniqueness of agriculture, mental health, and suicide, and to see if we need to do something separate, differently than we are doing. And if there's anything that we've heard here today, we've heard a lot from all of us, is how different we are, how different this sector of the American economy is, and maybe we can look at how we can support that sector in a way that they can accept that. And I think that's my hope and vision for this. And I will, to be honest, when the bill that created CRIS, working with Representative Orwell, when this came down, the 988 bill, I think in 2019, I think it was, but we were working on agricultural issues then. And we decided that with Representative Orwell's nudging, I came on board with this and signed on to her bill to do this. And I don't think we're there. And so I'd like folks to take a hard look at helping us get there. And I just, if anything, I just ask you to keep an open mind. And thank you.
I can't thank you all enough, really. And I actually want to read you a comment from one of our CRIS members, because I think this says it all. So Michelle McDaniel, who's one of our 3 call center leads on the CRIS committee, writes, this has been an outstanding presentation. I look forward to sharing the video of it with my staff at Crisis Connections. This has made me appreciate our farming and agricultural community at a whole new level. And I'm feeling the same way. So thank you so much, Representative Schmick. I know Don had to leave. He actually took time out of his vacation with his daughters to come be part of our panel today. But Rob driving all this way to be part of this, and Cassidy, who jumped in late in the game and to help us out and present, and Levi, who's just been such a dedicated CRIS member, and Connie, who also jumped in and also did this fabulous presentation, and most of all, Representative Dent, for getting us here and for helping us plan this and figuring out who should be on the panel, and for all of your wise words. So thank you. And thank you, everybody. I know we ran quite a bit over what we had planned in terms of timing, but